My diagnosis is dermatomyositis, which is a rare neuromuscular disease. And I unfortunately got this disease about 4.5 years ago. Started off with a rash, ended up having muscle pain, and just kind of continued to deteriorate.
Patty first came to me about 4 years ago, and when I first saw her, she carried a diagnosis of dermatomyositis, but she wasn't doing very well. She wasn't treated optimally, and she was having some side effects from it.
Dr. Freimer is just amazing. And my husband and I, when we walked in, I think I felt, just relieved just meeting her.
She had been an aerobics teacher, and she could no longer teach, and it was very distressing to her. That was her livelihood. She came to me, she could barely get up out of a chair. She had to use her hands to push herself up out of the chair. She had weakness of her arms and some weakness of her face. She also had a very significant skin rash that was uncomfortable. It was itchy and a little bit painful. And she was so relieved to meet somebody who had cared for more than one patient with dermatomyositis. And at Ohio State, we have a very large muscle and immune-mediated disease center as part of our neuromuscular center. And so we see a lot of the patients who have dermatomyositis or other autoimmune diseases affecting the nerve and muscle. I think just the fact that I was comfortable with this disease and I could talk to her about what caused it, and we went through a number of potential treatments, made her feel much more comfortable coming to me as her physician.
Ohio State was great in the fact that Gahanna Care Point Center has this wonderful infusion center. The nurses are awesome, and they also have physical therapy at that facility that I went to. So I was doing physical therapy there and doing my treatments there. Along with that, I went to occupational therapy. So it was a combined effort that definitely, made it successful.
We decided to try to minimize the side effects of steroids and opted to use intravenous immunoglobulin to treat her. She initially started on a pretty intense regimen, and then we've slowly been able to decrease the frequency.
When I started treatment, probably the first thing I wanted to be able to do is to be able to take care of my family, to be able to cook. To even just go for a walk. I used to teach fitness classes, so that part was very devastating. I went from working out every day of the week to not being able to do anything. So, I thank heavens I'm a very patient person because it took a long time to get there. But I am very grateful because now I can.